So to put the eye drops in your eyes correctly, you can follow these steps. First, wash your hands. Use soap and water or hand sanitizer to clean your hands. Check the expiry date. Make sure that the eye drops are not expired. Tilt your head back and look up. Prescribed a number of drops into the eye pocket. Close your eyes and keep it closed for at least 30 seconds to 1 minute. Repeat the steps for the other eye. Wash your hands again after using the eye drops. Wipe the excess of drops falling on the face like that using a wrapper or a tissue paper. Patients with glaucoma who are having high intraocular pressure should avoid medications that increase the intraocular pressure or cause damage in the parts of the eye. Like steroids, oral steroids can increase the pressure in the eyes. Topical steroids or oral steroids for a long time should be stopped. Antihistaminic, these medications can cause people to dilate, which lead to fluid buildup in the back of the eye, in the posterior chamber in the eye. And decongestants like these medications can increase the eye pressure, and some toxin injections, botulinum toxin is for some facial corrections. These injections should be avoided around the eyes, which can cause temporary blockage of the fluid drainage mechanism. Normally, we should talk to the eye doctor and primary care physician about which medications are best for you, and then that has to be used in glaucoma patients. I am Dr. J.P Divakar. Normally, as doctors, we advise the patients to put the eye drops at home. So, to put the eye drops in your eyes correctly, you can follow these steps. First, wash your hands. Use soap and water or hand sanitizer to clean your hands. Check the expiry date. Make sure that the eye drops are not expired. Then tilt your head back and look up. You can also try standing in front of a mirror to help you. And then pull your eye down. Use non-dominant hand like left hand to pull your lower lid down and away from your eyeball to create a socket. Hold the eye drops upside down and squeeze the prescribed number of drops into the eye pocket. Close your eyes and keep it closed for at least 30 seconds to 1 minute. Press on your the index finger lightly on the small fold on the inner side of the eyes to keep the drops from draining out into the nose. Repeat the steps for the other eye. Wash your hands again after using the eye drops. Wipe the excess of drops falling on the face like that using a wrapper or a tissue paper. Patients with glaucoma who are having high intraocular pressure should avoid medications that increase the intraocular pressure or cause damage in the parts of the eye. Like steroids, oral steroids can increase the pressure in the eyes. Topical steroids or oral steroids for a long time should be stopped. Anticholinergic eye drops are the medications that can cause eye-related side effects, including temporary blurred vision and acute angular closure glaucoma. Anticoagulants like blood thinners can cause bleed in the back of the eye or the vitreous, and which can block drain the angle of the anterior chamber, causing increase the pressure. And sulfonamides are the drugs that induce acute angular closure glaucoma. Antihistaminic, these medications can cause people to dilate, which lead to fluid buildup in the back of the eye, in the posterior chamber in the eye. And decongestants like these medications can increase the eye pressure, and some toxin injections, botulinum toxin is for some facial corrections. These injections should be avoided around the eyes, which can cause temporary blockage of the fluid drainage mechanism. Other medications that can be dangerous for people with glaucoma include ioptonium chloride atrovent or titanium bromide sperio, and some other drugs used for chronic obstructive pulmonary disease should be avoided. And medications like motion sickness medications, tricyclic antidepressants, nausea or gastric reflux medications, and drugs used for incontinence or overactive bladder medications. Vasospasm medications should be avoided in patients with glaucoma. Normally, we should talk to the eye doctor and primary care physician about which medications are best for you, and then that has to be used in glaucoma patients.